and welcome to For Your Health. I'm Mark Crosby. Thank you so much for joining me and my guest. She is a public health nurse here in the city of Quincy. This is a test. Who is she? She's a public health nurse in the city of Quincy. She has been on many of these episodes. I'm speaking of Caitlin Kirby. Caitlin, welcome back.
Thank you for having me.
Very good to have you. This program we have done in the past. Every year we revisit the topic. It's the seasonal flu.
Yes, and we always like to highlight it every year because they do, again, change like the vaccine formulas. And just where it is an annual flu season, it's important to know that the risks are still there and it is still important to get that flu vaccine. So it's always a nice reminder to people as to why they should protect themselves and those around them.
And I guess I think I know this, that determining what needs to go into the vaccine is based on where the flu has already hit other countries?
Yeah, so they collaborate and they monitor year round all the virus strains that are going around. And this year we have a trivalent, which it has been for recent years. So it's basically covering 3 strains that they are noticing are making people very sick in other areas of the world. So that's how they know what to fight against for this year's flu vaccine.
Very good. It's always great to start with an overview so that I think I've said this before, so I know what to expect from you and viewers know what to expect from both of us. So we will start with a definition. What is the flu? How the flu spreads? When are people with flu contagious? Common symptoms. People at higher risk from flu. Complications and treatment. What's new this flu season, as you had alluded to. The CDC recommendations for flu prevention. And lastly, we will hint on resources. So, what is the flu, even though that might seem simple?
Yeah, so it seems simple, but it's always nice to cover. So influenza is a contagious respiratory virus that can cause infection and illness for the nose, throat, and sometimes even the lungs. And it can give individuals mild to severe illness. The 2 types of strains, so type A and type B influenza viruses that routinely spread, that is what gives us our flu epidemics every single year. And it's important to know in the United States, our flu season is mostly in the fall and winter, with the activity peaking in December and February. We're in September right now, going into October. It's a pretty good time to get vaccinated. And you, I'm sure at home, are seeing the commercials and advertisements. But by the end of October is when you want to get vaccinated.
And I think in the past, maybe even this year, and I could have missed it, those advertisements were out early in August. So is there a problem with getting a flu shot too early?
So if you get it too early, you run the risk of your immunity not having like top immunity by the time it's peak season.
Okay.
So we always say consult with your doctor for the best time for yourself, because there are people with other health conditions that could increase their risk of complications. So if you're unsure, check with your doctor on when you should get it. But for the average person, around the end of October would be when you want to shoot for.
And I suppose it makes sense because as we come indoors from spending time outdoors during the summer, in closed spaces with other people, there's more of a chance of anything spreading.
Yes, because with the colder months, your windows aren't open. Again, you're gathering indoors rather than outdoors. So not only do we see the flu, but we see, of course, COVID, RSV. So there's a lot circulating. So we'll get into those preventative measures on how to protect yourself, not just from flu, but all those other respiratory viruses you could get exposed to.
Right. Okay, how does the influenza spread?
Yeah, so the image I have with this slide is pretty gross. It's
I was
somebody
going to say it's pretty
sneezing.
disgusting.
So when a person is sick with influenza, when they are talking or singing, sneezing, those in their respiratory droplets, they're spreading that virus. Less often, you can also get it from objects. So this virus, if I, God forbid, were sick right now with this virus and I'm coughing on the table,
I'm in trouble.
we don't clean it and then you touch the surface and your
Right.
face, you could get exposed. Typically they say for surfaces, especially if it's a hard surface, it can last up to 48 hours, which is a pretty long time.
2 days.
Yeah, so you want to make sure, especially if you're having a gathering at your house, you want to make sure you're cleaning those high touch surfaces. So your doorknobs, that could be at work as well. And a big thing, you want to think of your cell phones, because we're on our cell phones so often and we're touching things and then our phone. And then next thing you know, you're in bed on your phone. So those cell phones can be very dirty. So make sure you're cleaning them.
Computers, too.
Computers as well. Yeah, anything that is touched frequently. So you want to make sure you're using, there are many products, and you want to make sure when you're reading the label for cleaning supplies that it does get rid of influenza viruses.
Now, of course, the right way to cough or sneeze is never without any kind of, I suppose, barrier.
Yes.
And we'll get into this, I know, but it probably doesn't hurt to mention etiquette.
Yes, and we teach this even with young children, like in elementary school is where we really start. But when you're coughing or sneezing, you want to make sure it's either into a tissue if you have that, or instead of your hands, you want to do your into your arm or sleeve. That way, it's all the particles going there and not on my hands and then on the table.
This guy had a tissue, but didn't
Yes.
use it correctly.
Poor etiquette. Poor
Exactly.
etiquette. Yes.
Okay, when are people with the flu contagious?
Yeah, so it's always important as a public health nurse. This is what we look at for any disease, any communicable disease. We look at the contagious period. So the influenza virus can be detected in an infected individual beginning 1 day before the symptoms begin, up to 5 to 7 days after they are sick. And people are known to be most infectious with flu for the first 3 days of their illness. But it's important to know some people, including children or individuals with weakened immune systems, they can be contagious for a longer period of time. And it's also important to know that if somebody is exposed to influenza, it can take 1 to 4 days for you to develop symptoms. So according to the CDC, theoretically speaking, you could get somebody sick before you're even symptomatic. There has been studies that show that for household contacts, so your close contacts, they can get sick but remain asymptomatic as well. So it's hard to know, but again, when we get into preventative measures, it's good to use those universally throughout all of flu season to protect yourself.
Interesting. I suppose the worry is that a person's contagious before they actually experience symptoms. Mm-hmm. You wouldn't know. The person that you're with at the time wouldn't know that.
Yes, and that's especially as we go into like the holiday season. You find like with those larger gatherings people go to, they might feel fine, so they go to the gathering and then they get a fever that night or they start a cough that night. So it's very hard to tell, although you want to protect those around you. It's hard to tell. And you always kind of want to think, if you are a healthy individual yourself, you'd like to think of, do you have high-risk people around you that you could get sick and potentially, because they can be very severe depending on the person. So you want to make sure you're protecting those around you as well, not just yourself.
Common symptoms. There are quite a few symptoms that are common, again, not only to influenza, but these kind of will pop up in other infections as well.
Yes. So that's also why it's important to consult with a doctor if you are starting to feel sick, because especially as we go into the season, it could be flu, it could be cold, it could be RSV, could be COVID.
Right. A cold is not the flu.
Yeah, so it's a difference. So you want to make sure you're consulting with a doctor and getting tested. I do know that there are home kits now that test for both COVID and flu A and B. So always check with your health department to see if they have those on hand. So for our common symptoms though, symptoms can range from mild to severe illness or also asymptomatic for some individuals. But what we mostly see is fever, chills, sore throat, runny nose or congestion, muscle or body aches, headache, fatigue, and vomiting and diarrhea, which is most common in children. But it's important to know that an individual, if you're diagnosed, you may not have every single symptom, and you might only have a few. So it does vary on that person and what other health conditions they may have.
I guess I wasn't aware. I was aware, I should say, of testing for COVID, but I wasn't aware that there's a test for the flu.
Yes, so actually in our health department right now, the kits that we have available do test for all three. So the flu, well, I mean all three by COVID, and then the type A and type B strains of flu.
Okay. People at higher risk from the flu.
Yeah, so it's always important to know your risk factors. So anybody, of course, is susceptible to getting flu if they're exposed. And they can have serious complications regardless of their age and health issues. But factors that increase an individual's risk for serious flu-related complications include people above the age of 65 and older. And that is because as we age, our immune system tends to decrease, so we can't fight off infections as well as we may have at one point.
Something great to look forward to.
Yes, and then also, unfortunately, in this population, we do see other comorbidities. We see other health conditions they may have, whereas younger adults may not have developed that in their lifetime yet. We also see people with certain chronic medical conditions such as asthma, diabetes, or heart disease, pregnant women, and then also children that are younger than 5 years old, especially younger than 2 years old. And that also goes along with like the immune system.
So that would bring me to pregnant women because they're carrying a baby, their immune system takes a hit?
Yes, because their immune system's working in overdrive at that point. So that's why they're at higher risk for all these complications. And then even our children younger than 2, we see a lot of our highest hospitalization and death rates among infants that are 6 months old and younger. And that's because their bodies have not been able, they don't have an immune system yet. They haven't had vaccines. They haven't been exposed to anything in the world.
Right.
So that's why it's harder for their bodies to fight off these infections.
Flu complications and treatment.
Yeah, so a lot of people who get diagnosed with the flu, they will recover in a few days to less than 2 weeks' time. But some complications that can arise, we see sinus problems and ear infections, pneumonia, which is an infection or inflammation of your lungs. We see dehydration, especially if you're thinking of that vomiting and diarrhea for children. If somebody's vomiting and having diarrhea, they're losing a lot of fluids and electrolytes.
Which at that point, it's very difficult to I suppose, impose fluid because that person doesn't feel like drinking clearly, but how important is it?
It's
Very.
extremely important because dehydration, I've been dehydrated many times in my life. You don't feel good, and especially if you're in that state and you're trying to drink fluids, but you're throwing them up. When you don't feel good, you don't want to be taking things in.
So what would you suggest, maybe sipping?
So yeah, sipping on things. And nowadays there's so many alternatives out there, like so many electrolyte packets, Pedialyte, like there's so many brands. I even know like they have popsicles you can have. So you want to try to find what works for you, but you want to make sure you're keeping things down. Or if you can't, if you notice you're vomiting, diarrhea, if that has been going on for days and you're not feeling good, you have to check in with your doctor because you may require hospitalization for IV fluids.
Right.
Also, we might see another thing is worsening of long-term medical problems such as heart disease or asthma. We also see brain dysfunction such as encephalopathy, which is it's characterized by disturbances in brain function that cause changes in your mental status, behavior, or cognitive abilities, which is very scary for people. And then in rare cases, death can even occur. So it's important to, especially, so for treatment, I also added on this slide, the CDC recommends early flu antiviral treatment for people who have flu or suspected flu, who are at a higher risk for serious flu complications. So if you're starting to feel these symptoms and you do have health conditions, like you do have a history of a stroke or heart disease, check in with your doctor right away and they may start you on treatment sooner rather than later.
One of the things that is common in children, and I see it here with ear infections, when you have an infection that kind of registers in your head and your ears haven't developed or the tubes haven't, I guess, adjusted themselves, fluid buildup is a common occurrence.
Yes, even my daughter, who is currently 15 months old, she has had, knock on wood, only 1 or 2 ear infections in her life so far, but it has all been led to congestion. She had congestion for a couple days, and then that fluid built up in her ears. And
the way the tubes are in young folks makes them more susceptible to ear infections.
Yes, yes, and it's very uncomfortable for them. So
Sure.
you often will know, but it goes to why it's very important to collaborate with either, if it's a child, the pediatrician, or your own doctor, because things can come up and you want to make sure that they're addressed promptly, and especially a child, like you don't want that pain to last long. Right. So.
I know sometimes if it has to be addressed surgically, often tubes are inserted to drain. I guess it must be the design of the ear canal as a child is different than when you're an adult. In other words, it grows and it changes its, I guess, direction. Yes,
yeah. So.
And you, of course, mentioned pneumonia too. That was.
Yes, and pneumonia.
Yeah.
And these can all be they can all end up to be life-threatening if they're not addressed. So that's why, especially if you have other risk factors, please check in with your doctor and don't fight this at home alone.
Right. New this flu season, breaking news. What are the strains?
Yeah, so to start off with, so everyone 6 months and older, with very rare exceptions, should get a flu vaccine every season. If you don't know for yourself, check in with your doctor and they'll be able to advise. And it's also, so the flu vaccines this upcoming season for 2025-2026, they are trivalent vaccines, which is, it protects you against 3 influenza viruses. So that is an H1N1 virus, an H3N2 virus, and a B Victoria virus. So I do on the slide, there was the egg-based vaccine and also a cell or recombinant-based vaccine. So they did update one component in each of those formulas. And I put on the slide also understanding the naming of flu viruses. But again, it's a type A virus and a type B virus is mostly what we see. But those names, because if you look at the name, it seems very confusing. But there are certain things that these scientists are looking at to identify these strains and to really determine what is making people sick this year and how can we best help them and give their bodies immunity.
I don't know if people say this anymore, but I used to hear people say, well, I didn't get the flu until I got the flu vaccine.
Yeah, so you cannot get the flu from the vaccine itself. You could have, at like a couple days after, you might have mild symptoms, just kind of like to a vaccine symptoms, like you might feel a little run down, but you would not get the flu from a flu vaccine.
And folks that I suppose could be or should be concerned about getting the flu vaccine, you had mentioned the egg component, or at least in one of the vaccines.
Yeah, so what happens when you get vaccinated, we are, as a vaccinator myself, we're required by the state and the CDC, we have to ask specific questions. For example, are you allergic to eggs? That may determine whether you can receive that specific dose or not. Also, if you had a history of Guillain-Barré syndrome, which is very rare, but it can cause a temporary paralysis. So if somebody were to experience that, they aren't to get the flu vaccine in the future. So it is dependent on that person. So when in doubt, check with your doctor to determine the best way to protect yourself and if you can receive it or not.
And pregnant women can?
Yes, for pregnant women, it is safe to get the vaccine.
Okay, so let's look, in addition to the vaccine, ways for folks to stay safe and healthy.
Yeah, so the number one is vaccination. That is what is recommended first and foremost. But also, and for example, there are people who cannot get vaccinated. So how do you protect yourself overall from these respiratory viruses as we're heading into the season? We have our favorite, hand washing regularly.
But hand wash for a specific time period.
Appropriately, yeah. So you can sing like 2 rounds of happy birthday in your head as you're washing your hands with warm soap and water. That is always your best avenue. If you're on the go and you have hand sanitizer, you can use that on the go. But you want to make sure the best way to wash your hands is always soap and water.
Right, but the alcohol-based sanitizers basically make the surface of your hands, I suppose, not attractive to viruses.
Yes, but the best, so it works on the go, but again, if you have a sink and water, that's your best bet. We also have stay at home when you're sick and avoid close contact with others.
So don't go to work, don't try to be a hero?
Yeah.
Because indeed you're not. You're being the opposite.
Which is tough though, because as we go into the season, allergy, like you might have other things. You don't always have a sick day to take. If you do have to go into work and you think you might be sick, wear a mask. Keep your distance from others. Cover your nose and mouth when you're coughing or sneezing. Again, the best bet, if you don't have a cloth on you, into your arm would be the best bet. Avoid touching your eyes, nose, and mouth, especially with unwashed hands. I think after the COVID-19 pandemic is when we all started to realize how often we do touch our faces. So you want to make sure you are not touching a surface and then introducing that through your eyes, mouth, or any other,
Or nose.
or nose. Clean and disinfect surfaces. So again, those commonly touched surfaces, your doorknobs, your cell phones, your bathrooms. We also have taking steps for cleaner air. You mentioned earlier that during flu season, we're indoors more because the weather is colder. So steps you can take: opening windows to bring in fresh air, using air purifiers, and gathering outdoors when possible. And then lastly, you want to practice good health habits to maintain your overall health. So I think we mention this in every episode we do, but this involves keeping hydrated, maintaining a healthy diet with well-balanced nutrition, adequate.
Right, because that can affect your immune system, just simply eating correctly.
Yes. They say you are what you eat, which is unfortunately very true. If you're only eating junk food, you're not providing your body what it needs to have a strong immune system. It also goes into adequate sleep. You want to make sure you're getting appropriate rest at night.
Which, does that vary from person to person, or is it 7 hours, 8 hours?
So it can vary. There's different studies out there that can determine women need more than men and all that. So I always like to go with the baseline. You want to shoot for 8 hours, which I understand is not always feasible. But you want to do your best to have a steady nighttime routine and a steady wake time routine is always the best way to do it. You also want stress management because chronic stress breaks down your body, and exercise. You want to make sure you're moving. So it's what we're told throughout our whole lives, but practicing good overall health habits really does build your system to fight against diseases and viruses.
Very good. We will end with resources.
Yeah, so all of the information I did collect today was from the CDC website, so cdc.gov. So it is all universal information. And if they had tons of tabs and so much information on this, so I definitely recommend people going to that website if they need any additional information.
Very good. Well, I want to thank you, as always, for stopping by and informing the folks here in the city of Quincy. And as we know, this program travels throughout the country, so thank you for informing folks beyond the city limits.
Yes, thank you for having me here.
You're welcome. And thank you at home for watching. Just remember to support the local access station in the community in which you reside and have a healthy flu season. Take care.